Hello, I'm Susan Toller, Vice President of the Florida Blue Foundation and lead of the Corporate Social Responsibility Team. I'm honored to bring you the first in our series featuring foundation grantees that are combating the opioid crisis in Florida. Gateway Community Services has collaborated with St. Vincent's Healthcare to place peer recovery specialists in hospital emergency departments to engage with opioid overdose patients. Watch now to see how these peer specialists are helping to convince people that recovery and life beyond addiction is possible.
So I started using opiates when I was 16. I was stealing them out of my mom's medicine cabinet, like a lot of people start. Within a year, I was waking up dope sick, and it became my entire life. My mother died of an overdose, and that is for me what really kind of pushed me and made me realize, this is not the way that I want to live. So I began living for her.
St. Vincent's wanted to be part and have peer specialists in our ED for a variety of reasons. For one thing, when City Council put this call out that we have to do something about the opioid and the overdose situation going on, and the ME is overwhelmed with people dying from overdose. In St. Vincent's, typically we look for people that are vulnerable to give medical help to, and who's more vulnerable than an overdose or patients that are addicted to narcotics? All it took was one call from me to our CEO, Tom Van Osdale, and said, hey, there's the opportunity to be part of this, and I think it's going to make a big difference and an impact in our community. And it was instantly, let's do it.
Once the OD victim has been stabilized, they will interface with that victim and establish a relationship, something that's really hard to do. Quite often, an addict or alcoholic who are in the throes of their addiction and have just come off of an overdose are just desperate to get back to their drug, and most people that would interface with them have never experienced that before. Now we have someone there who can really be there heart to heart. I've been there, I've done this, and I can actually work with you and talk with you, and that's the interface.
The interesting thing is not too many people believe that the recovery is possible for them because a lot of the shaming and blaming and the family systems issues that they dealt with themselves. But when they have a peer that stands beside them and says, me too, that happened in my home, and that's how I found myself using just like you used, and now I'm in recovery, and I can absolutely show you how you too can find recovery.
When I first engage a patient, it's kind of important to sort of gauge the room, gauge the environment, see where the patient's at and how they're feeling. The most important thing, and what is really, really amazing to witness, is when I open up and share a little bit about my story, you see this switch. It's like a flip goes, or a light switch goes off, and they instead of seeing you as a doctor or a nurse, they see you as someone that they can relate to and someone that they can talk to, someone that they can open up to.
When I went to the providers, and the first thing I said is, guess what, we're going to be a pilot site to attract overdose patients. It's like, are you crazy? And then once they got to start hanging out with the peer specialists and see the impact they had on their lives, all of a sudden they'd come up to me when I was rounding in the ER and say, you know what? I had an overdose patient, and they were excited talking about it.
I've lost 2 brothers due to their drug using. I lost my father due to cirrhosis of the liver. So even in my own family, I know there's a big situation around substance use and wanting to escape from reality. And then once I met someone that had had an experience with their own personal recovery and was able to speak the language of the heart to me, that's when I said, well, maybe it is possible.
So really having the ability to help these patients so they didn't just keep coming in 2 or 3 times in one day, multiple times a week or a month. You see them one time, and our chance to make an impact and make a difference in their lives was tremendous. We weren't seeing the same patients over and over and over. So there was so much positivity. Every doctor was like, man, I can't wait till I get an overdose patient. It was exciting that they could make a difference.
Over the course of time, what we've noticed is that now we're at 50% going into treatment. So those who were originally involved in the program that were refusing it are now realizing that they need treatment, and they're now wanting treatment and wanting recovery.
What I really like to pull the peers in that I work with, the team that I have an honor to work with, I like to pull them in and give them the ability to see that there's something past their substance use and to be able to find a way into the future, sharing their lived experience with other people and offer more of a hand up versus a handout.
Blue Cross absolutely saw that this is making a difference in over 2/3 of the patients' lives that are coming in, where before I may have had 6% people willing to get involved, I have 2/3, and that would have never happened before. So we know the peer specialists are working, and right now we're learning how to take that to a larger scale for the entire community of 1.5 million across the state, and we have 153 hospitals within our Ministry of Ascension, and they're all looking to what they can do next to help combat the same problem that we're dealing with in Florida. It's in the entire country. So it's been exciting that knowing this is going to get continued on with the work.
Being a recovery peer specialist has helped me in that I think it's given me a lot of confidence in many aspects of my life. It's a daily reminder of where I have been and to stay sober. Also, it's given me a career path. I know now what I want to do with the rest of my life.